Hello. Okay. Hey Frank, how's it going?
Doing good.
Good. Awesome. Okay. So I know you're getting ready to get all discharged and everything. Before we have you go, we wanted to touch up on a couple of main points. Okay. So I know you've received a new diagnosis of type 2 diabetes, which can be very intimidating, and I can say from personal experience because I have that as well. But regardless, and so Frank is a 53-year-old construction worker who was just diagnosed with type 2 diabetes, mellitus, and he has the fruity breath, fatigue, polyuria, weight loss, polydipsia, and he did present with abdominal pain, so could have been, I shouldn't say could have been, was on the kind of on the fringe of diabetic ketoacidosis. I think we caught it in time, which is good. That doesn't always happen. His blood sugar was 315, so definitely up there. And so and so he okay, and so he wants to understand the diabetes a little bit more, and so to help kind of expand his understanding, and Frank being a construction worker, he already told me that and he's kind of like the engineer construction worker, if that makes any sense. He kind of works with the foremen and stuff. He learns best through kind of verbal discussions, graphs, kind of visual aid stuff. So I'm gonna try and compile a bit of a graph here for him to kind of help understand things, or just some diagrams or charts if necessary. And so essentially, okay, Frank, so we'll just say this, okay? So with, let's say nutrition, okay? Then we have medications, okay? All right, and medications, all right, then we're gonna go, okay? Okay. All right. So what we kind of discussed was sort of what we call a whole foods, plant-based diet. Okay. And so with this whole food plant-based diet, so this diet is kind of a catch-all. It's sort of has carbs. You got your greens. And we're talking your broccoli, Brussels sprouts, okay? And we also have fats. So this is also kind of combined with Mediterranean, and so the Italians are kind of on something, vino mas, more wine. Obviously, as a diabetic, you want to be careful of alcohol intake. So, I'm always very cautious. I've been sober for about 2 or 3 years. Don't get me wrong, I love whiskey as much as the next guy. Just for me personally, I stay away from this, but I know celebrities and other folks who will have like just the occasional glass of wine at like a specific function or social, and like that's it. But it's just because of how the kidneys work and all this stuff. This can wine or alcohol in general can kind of accelerate you into a state of diabetic, what we call DKA, diabetic ketoacidosis, and that's what you came in with, and you presented with the signs of that. So that's something that we want to avoid. Obviously, like all the time. So, and then discussing in your diet, we have a good carb ratio, greens, fat content, And, oh duh, of course, how could I forget protein? Protein. And so this, you know, have chicken, turkey, kind of stay away from red meats, if you can. You know, beef once in a while is okay. In a while. Okay. And so this one with beef, you just want to be careful because this one is it's a saturated fat, so it can clog the arteries. And so, you know, experts, you know, say with chicken and turkey, you know, you can have a lot more of. It's quote unquote safer to have. I love beef as much as the next guy, but I want to be around, you know, for my kids and all that. So, you know, just looking at, and diabetics are more prone to, you know, other certain metabolic conditions like, you know, hyperlipidemia, you know, high triglycerides, you know, issues with arteries kind of getting clogged and watching the plaque on the sides. So by kind of, you know, sticking to this diet, essentially, you know, you're going to be good to go in a sense. So, and we can address with questions at the end. Okay, so with medications, what we talked about with your Dr. Feinstein, we're going to be doing 1,000 milligrams of metformin. Okay, and this is the XR tablet. Okay. All right. So it's the extended release. It's not the short release. So you're going to take this two times a day. You're going to take 500 milligrams by mouth twice a day, and then we'll do AM and nighttime. Okay, and then something else, you know, that the patients seem to have pretty good success with is something called a GLP-1 analog. And so basically what this does is it kind of helps your body feel fuller, faster. And so essentially what that means is it can kind of help you feel, it'll sort of decrease your appetite. And so it will kind of help change your metabolic needs, things like that. And so kind of a fortunate byproduct of taking this can be weight loss. You know, and who doesn't want to, you know, lose weight, you know? But one must be careful when taking this. You gotta make sure you stay hydrated. This drug needs a lot of water. Oh, that's a tongue twister. A lot of water to work. So to help with circulating it and going through the liver, and this is the same with metformin. The two big things with these are acidic, more so with metformin, going into a state of what we call lactic acidosis, and that's not good. That's really bad. So it's basically like when it's kind of similar to DKA, but basically your body is relying on a very nasty byproduct in order to operate, and it eats away at your muscles, essentially. So we want to stay away from that. So water helps with getting, staying away from lactic acidosis, and you will feel on the GLP-1s, it takes your body like 2 to 4 weeks to get used to it, and your blood sugars are kind of funky. So it kind of helps stabilize it, get it into a routine. There's kind of like the initial sort of adjustment side effects that you'll need to worry about. So like abdominal pain, you'll feel some, but I mean, if you really feel a sharp shooting pain, please come in right away. Don't hesitate, okay? or back pain, or like side pain on the ribs. You don't even want to mess around with that. Now, oh, I'm sorry, I didn't address when you should take your injection. And so we're going to give you Ozempic. This is what we talked about with Dr. Feinstein too. You're going to just literally do it once a week. 1 week injectable. And we're going to start you off on the 0.75 milligram one. Basically it goes in quarter increments, and we kind of tie this in with body mass and what the metabolic needs are. So we're going to try this one, and so it goes in quarter increments. So more or less, if we need to, we can adjust your dose, and if we need to, say put you on the 1 or take you down, depending on if the side effects are too strong or anything like that. It just kind of depends. Everybody is different. Everybody's body is just different. So we want to find what works for you. And so what we call titrate, or find an ideal dosage to where you can, still go about your daily life, not have to worry about your blood sugar, and yet not feel crappy all the time. That's what we're aiming for. Okay. And lifestyle, working out. I mean, you're already on your feet quite a bit, so walking is a good thing. I don't think that this should be and too much of an issue for you. But with your wife Edna, you can go ahead and do walks 3 times. We're gonna say per week, and 30 minutes each time. And so there's some variation on this. The main thing is like you don't always want to be sitting down. You want to be moving. Okay, this helps. Not only help prevent diseases like Alzheimer's, but it also helps kind of keep your diabetes at bay. Okay, because when you're moving, that means your body is using the sugar as a source of energy breakdown. Does that make sense? Do you have any questions? Okay, sorry. Okay, and then so working out, and then we've already kind of talked about alcohol intake. And even if you start taking other supplements, since it is a form of metabolic syndrome diabetes, if you take any supplements, please ask us about it. And if it's, sometimes patients like to try some really funky supplements. There's nothing wrong with that, but please let us know, because sometimes the chemical ingredient that's in the supplements can counteract or inhibit either the metformin or the Ozempic. And so everything gets processed through the liver. And so say if it's a chemical or something that tries to go in the same processing channel as with Ozempic or metformin, there's not going to be a good reaction, and that's what we want to avoid. Most things are okay within reason. Okay, I don't want you taking 5,000 milligrams of ginkgo biloba or berberine or something, because that's also going to impact your liver and metabolic function while compared with these two drugs. So berberine is a natural supplement that patients use for diabetes sometimes, and so sometimes when they collaborate it with the other medication, it has an added therapeutic benefit. Let's see. With that, so, but we got to find the right dosage, okay? And so please keep us informed. If you have questions, no question's a stupid question, okay? I know I've been throwing a lot at you here. And so Oh, sorry. My gosh. Okay, I'm gonna keep this simple. So we gave you what we call a CGM, and this is a continuous glucose monitor. Okay. All right, and you have what we call the free. Oh my gosh. Sorry. The Freestyle Libre. Okay. And so once a week, or we'll say every 7 to 10 days, you change this. But something also to keep in mind is your portable, portable glucometer. And so this one you can take with you. So I always have a backup. I have my my CGM, right, paired to my phone, and then I also have my individual glucometer, because sometimes these things kind of they stop working, or the connection goes, or something. And if you need to like get real-time results real fast, you should have lancets, which, as we already talked about, are the things that you poke your finger with to get the blood. Have an alcohol swab, so that no bacteria, or there's like already sugar there, and sometimes you gotta wipe that off. And so to give you a weird artificial reading like 600, which is an insanely high number. And test strips, and then you put your blood on that, and that will thus give you the deciliters. And so 70 to 100 is normal range, and this is what is said by the ADA, the American Diabetic Association. Between 70 and 100 is where we want to see you. Now this is ideal for non-diabetics, but since you're diabetic, so the ADA, again, 7.0 A1C, okay, when you have to stay below that, that is essentially an average of your blood sugar being at 150 150 milligrams, or not milligrams, points per deciliter. That's it. So, and then if when you eat something, and then if it hasn't gotten back down to 180, over 2 hours, then that means that you have ate something way too carby. So essentially, 70 to 100 is ideal, but 70 to 150 is good. And then check out that 2-hour amount. Let's see. And yeah, it's good to keep a log, of your blood sugars, especially like the first couple weeks, and just so you're kind of aware. This is, have a food journal. This is what, impacts my blood sugar this way. So, okay, so we want to make sure. I think I covered everything. God, sorry if it looks kind of like a mess, but do you have any questions?
I just have one.
Okay.
For the Ozempic, the 1 week injection, if I'm planning on going somewhere for a week, can I just take 2 in 1 week?
No. I'm very happy that you asked that question. So, not a bad question, not a bad thought. So, we want you to stay on your regular dose.
Okay.
And so, it's good to go on vacations, have a meal plan, have the adjustments, continue to take your medication as prescribed, don't deviate from that. This can send you into a lactic acid state, or basically an acidic state, or cause a bunch of liver problems if you double up on it, and it's not fun. And you'll also be, you will also be having a lot of bowel movements. A lot of GI distress that one can cause. So, great question. Yeah, do you have any other questions?
Nope, that was it. Thank you so much.
Okay, awesome. Thanks, Frank. Okay, be in touch.
Okay.
Yep. I don't even want to.